Hello, I'm Barbara Maxwell. I'm the chair of the Physical Therapy Academy and I work at A.T. Still University in Arizona. And I'm here to talk to you a little about the causes that we as the National Academy of Practice may wish to engage in as part of our advocacy work. So when you're thinking about taking action, it really requires a commitment and a passion and an investment in a cause. And if we're truly to be advocates, we really need to get behind our cause. So what we're asking you to think about are what are the causes that excite you, that excite members of NAP, that brought you to NAP, that got you engaged with NAP? What was it that you were hoping that NAP as an organization might be able to do? We have some clues for these things in the history and the mission, vision, values, and strategic plan of the National Academies, but they can also come from a very internal and personal place. At the NAP Forum, we asked workshop participants to answer the question, what leads you to adopt a particular cause? And these are some of the responses that people gave in answering that question. So there was a clear focus on helping others reach potential, a personal connection, something that resonates with me because I care about it, making a difference, connecting to my purpose, empowering people, improving care, and helping the larger group. So we get some idea from these responses of the types of causes that NAP members might be interested in. But we need to think beyond that, not just what we as individuals might be interested in, but what are the causes that actually unite the membership of NAP? I could think of topics raised at past forums, issues in our mission, vision, and value statements and our strategic plan. But we need to really identify causes that we can tackle as a unified organization. It's different from professional advocacy that we may be familiar with within our own professions. Professional advocacy can tend to become territorial at times. But this type of advocacy, this united advocacy that we're looking for within NAP is different. We need to identify causes that we can advocate for together. Not only that, the causes that we are better able to tackle because we are together and united as an organization of diverse but united professionals. We need to think of the causes that we can tackle and have greater strength in tackling because we are a united group of different professions. We need to think about the causes that ignite us into action, that make us willing and eager to take the next step, to commit the time, the effort, and resources to lead to change. As I said before, we have some clues for this within the NAP mission, vision, and strategic plan. We've identified various aspects in which we as an organization, what we stand for, what we would advocate for, where we want to go as an organization. And with the NAP public policy principles, we have some really clear clues about where NAP believes that we need to advocate. You can see in the principles a focus on affordable healthcare, on prevention as a core strategy, on primary care, the importance of physical, behavioural and social health, advocating not only at a state but also at a national level, and a clear focus on interprofessionalism, both in research and education, but also in accountable interprofessional healthcare. And you can see we also wish to tackle things like coverage and the cost of patient care, and making a system that allows patients to understand their healthcare and their healthcare system, that's cost efficient, fair, and accessible. And while we believe in a single payer system, we're cognizant of current climates, current political climate in particular, in supporting public and private option and trying to find ways to better serve our patients within the climate that we are in. We need to come together to select causes that NAP is well placed to address, that in a collaborative, united NAP voice, we can work together for advocacy, for the advocacy of those that we serve.
Welcome to the National Academy of Practice Advocacy Agenda. This section will be content. My name's Lynn Reed, and I'd like to introduce the other folks that worked on this project with me and will be presenting. Marjorie Geis-Everson was not available to present today, so I will be presenting her section. Lucille Ferreira was our facilitator for our section when we did our breakouts later in the day, and we appreciate her work. Andrea Sonnenberg will be presenting after me. So from our 2018 meeting, one of the vision statements was interprofessional partnerships, advancing collaborative practice, education, research, and policy. And the question was, how can we advocate together? How can National Academies of Practice bring forth the expertise of all the academies, of all the professions, and really come together, identify topics that we want to talk about to make a difference for the patients that we care for? We did a survey of those who were able to attend to join us that day, and the question was, what is your level of expertise and experience with legislative and policy advocacy? Because we thought it was very important as we presented during the day to understand our audience, but also as we look forward to being together in 2019, what would we need to do to prepare the skills necessary and the content to be able to present a specific area we would like to address. So you can see from the audience, 23% had no experience in advocacy or lobbying activities previously. 30% were novices, felt like they had a lot to gain, but they had a basic understanding. 37% had independent skills to advocate, were totally prepared to hit the hill, go to their state house, have a conversation with a policy or legislative individual. And experts were those folks who really are just off and running and probably are writing policy, adding legislative content to or language to different legislative vehicles and modalities. So advocacy is so many things, and the Merriam-Webster Dictionary says that it's the act or process of supporting a cause or proposal, the act or process of advocating. So I always like when you use the same word twice, but they did. And here you can see many different things as the group was getting our slide deck ready that we thought of this Wordle or word cloud that gave us an idea of all the different things in healthcare that we could possibly address together. And so this is available for you to sit and review longer than I'm here talking with you today. So together we can make a difference. That's truly what came out of our work together, and that bringing many different thoughts together to create good vision going forward was the strength that National Academies of Practice had to offer. So how would we create our content? How would we advocate? And Andrea provided us this template to really look at a specific policy or legislative activity we might be engaged in. And this opioid crisis wasn't really anything that was chosen, but these are exemplars. So really establish your credibility with your audience. And as 14 healthcare professions who span healthcare, we have expertise in health and well-being and feel that we could advocate on this topic. And then identify the scope of the problem. Well, there is increased overdose deaths from any kind of opioid, and certainly the fentanyl and the other medications that are the synthetic medications that are being produced have become a huge issue with street deaths related to folks who can't get to their prescription drugs anymore. Intersection of pain relief and the toll from opioids is another issue that we would focus on to discuss the scope of the problem. So again, looking at the literature, whether it's the gray or the published literature, the peer-reviewed literature, so that we have clear information and data to discuss with the policymaker or the legislative aid or the legislator themselves. But how opioids have always been prescribed has been an issue, and they were in large quantities, they were readily available, they were left in drawers or under cabinets so people could divert or use them to overdose or give them to another friend who might have pain. So also how we are educated to prescribe and use pain medications. So when we look at a policy-based solution, there's a move to unimodal pain management, or move from unimodal pain management, meaning just prescribing an opioid to using multimodal pain management with minimal or no opioids or opioid-sparing techniques. So looking at the many receptors, the many places where pain is perceived in the body, and addressing them versus just addressing numbing the brain, one receptor site, has been very successful. And could we move more into the policy space that it's required that you use multimodal pain management for opioid-sparing techniques, so that you don't expose people to the risk of addiction because they were first exposed during their healthcare experience to manage their pain. So huge education to move public perception, to move medical professional or healthcare professional perceptions of how they manage pain, and also expectations from all parties. And last is the call to action. So a continued focus on opioids will only result in harm and death. So how can we learn to manage our pain without opioids? And this is the way forward.
So now we're going to give you a couple more exemplars that follow the same framework. You always do need to establish your credibility. I mean, you are an experienced nurse at whatever level you practice, and you know far more than whoever you're speaking to. So it's very, very important to establish your credibility by saying what your degrees are, how many years you've been in practice, and if the particular point of advocacy is related to your particular area of practice, then stress that. And so then we need to lead to the scope of the problem. So this is basically giving the background. So for our example on the Children's Health Insurance Program, which has subsequently passed actually, but we wanted to use it as an exemplar because it really has some very good highlights to work toward being an exemplar for an advocacy argument. So anyway, we wanted to show the scope of the problem by saying, first of all, what the growth of the enrollment is in Medicaid and in CHIP since the Affordable Care Act passed, and then how many children there are percentage-wise in the US population, and how many of those children are covered under other public insurances. When we do the scope of the problem, we always want to think about what the oppositional stakeholder is going to argue. And very often this has to do with cost. And once we identify the oppositional argument, we need to inoculate it, because you can be assured that whatever you're arguing for, somebody is right outside this legislator's door waiting to come and argue against it. So we want to inoculate those arguments during our advocacy presentation. So in the idea of cost, to inoculate the idea that cost should be a barrier to passing the legislation, we want to talk about the Congressional Budget Office estimates, and we can basically show how we inoculate that enacting this legislation would actually decrease the deficit by $6 billion over the following close to decade. So that's a really good oppositional argument. And then we want to present a policy-based solutions. And in this case, there actually was already a bill that we identified, Senate 1827, which was called the Keep Kids Insurance Dependable and Secure Act of 2017. So we want to identify the bill, and we want to identify basically the basic point of the bill and how that's going to address the problem that we are presenting and how it will reform it. And then we want to make a call to action, which is that we want them to fund CHIP. We want them to vote yes on the bill we identify. And then we want to tell them what is going to happen if they don't renew the funding. And that would be that 2% or close to 2 million children would be added to the uninsured rosters rather than be covered by public insurance, right? And this would lead to over 6 million uninsured children. Now that really is a very dramatic example. And one thing I did forget to highlight is that when we're talking about the scope of the problem, if this is your area of expertise as a nurse, or if you have a friend who's experienced the problem, put in a very poignant personal story, because personal stories always really get someone's attention and tug at the sympathy factor. And so that really gets them to kind of listen more closely. So that's our CHIP exemplar. And now we're going to go on to an example on diabetes. So another exemplar we thought we would outline for you is the problem of diabetes. We hear a lot about this in the lay media, and we know that obesity is an epidemic and that diabetes is an epidemic. And so we wanted to talk to diabetes. So again, first, establish your credibility. What are your credentials? How long have you been in practice? Is your specialty related to diabetes, or do you have exposure to patients with diabetes in your practice? And then again, highlight or outline the scope of the problem. And so this, again, would just basically be the sociodemographic and epidemiologic statistics around the chronic health condition of diabetes. And again, it's really important to include a poignant story or poignant anecdote of your own. If it could be one of a patient of yours that you took care of, or it could be of a family member if you haven't had a patient who suffered from diabetes. But a poignant story really grabs attention. And then we want to be very, very specific when we introduce policy-based solutions. So in this case, we're highlighting that we needed the appropriations to be approved for the CDC's Division of Diabetes Translation, and also those approved for the CDC National Diabetes Prevention Program. And at the time of this program's development, those had not yet been approved. I think subsequently they may have been, so that's great. And then again, our call to action is that we need research funding and we need programmatic funding, both of which would address this incredible epidemic of diabetes in our country. And we want to highlight what would happen if there weren't funding. So we want to give those negative scenarios to the legislators or to the stakeholders who we are advocating or lobbying. And so these are two exemplars that really show how you format your argument, that there are basically the four elements. You need to establish your credibility. You need to summarize the scope of the problem with some epidemiologic and sociodemographic data. We need to be specific with policy-based solutions, describing it using a cost-quality access framework. We need to include some evidence or science why the policy solution is helpful. We need to be very, very specific about, for example, what sphere of government we're talking about. In these cases, we talked about the CDC, which is federal, and we also talked about the CHIP appropriations, which were also federal. And then what policy reform we are actually proposing, and then the call to action, which is somewhat of a summary of that, but also includes what might happen in the negative sense. What negative outcome would there be should they not approve your ask or agree to do your ask? So these two exemplars highlight that. Thank you so much for your attention.
Hi, I'm Dr. Debbie Abel, one of the audiology NAP members, and we gave this presentation in conjunction with Dr. David Woodruff. So our portion of the advocacy workshop was to talk about the constituents. Who are they? And sometimes we think we know who our constituents are, but it may be larger than what we think they are. So let's go back down to the basics and look in the dictionary, and you'll see the web address as to where we obtain this definition of what a constituent really is. It's actually can be an adjective or it can be a noun. So let's talk about the adjective side of it. Being a constituent is being part of a whole. It's being part of a voting member of a community or an organization and having the power to appoint or elect. So all of us are NAP constituents, but we're constituents of other organizations, our professional organizations, our community organizations, maybe it's the Chamber of Commerce that many of us belong to, but that kind of tells you what being a constituent is when you're a part of the sum of a whole. In terms of a noun, it's actually the actual person. A member of a constituency would be you as a member of, say, NAP, or you as a member of one of your professional organizations. Being a constituent is being part of something. So you're one element of a whole portion, a whole organization, along those lines. Next. Who are our constituents? So as healthcare providers, regardless of what our profession is, we all have constituents, and some of them are the same. There are patients, they are consumers, and sometimes they're not always the same. We are also training students as part of the professions going forward and in recreating and repopulating for those who come after us. So the students are also our constituents. Researchers, sometimes for those of us on the clinical side, we forget sometimes that researchers got us where we are. They give us the data that we need for everyday clinical use. And then there are those without a voice, and you can see one of those right in the upper right-hand corner. And we all deal with the same population, whether it's birth or up to death. At some point, we will all have the same constituents. Of course, there's an interprofessional impact for all the NAP academies and those whom we serve, as just discussed. So you can see with the other photographs that are noted there on this slide, it's different aspects of healthcare, and it goes from birth to death, essentially. Next. So there's so many opportunities when you're a constituent or representing constituents, and there's so many decisions as a result. So when you look in the core, in the center of the slide, NAP advocacy, where does it all go? How do these things all interweave? Of course, we have the patient. Just noted, we have the student. We serve as educators. Other of our colleagues serve as educators. Research, we have colleagues that do nothing but research. And then we have colleagues that are nothing but clinicians advocating every day for those patients whom we see and serve. And of course, and especially as the population is getting older, we're also dealing with many caregivers, and especially for those healthcare professionals who deal with end of life, with those having treatments for cancer or a variety of other things. They are dealing a lot with a caregiver, as well as for elderly patients who have their children as their caregivers. So all these circles wind up being part of the whole picture of where NAP advocacy lies. Next. So let's define a little bit more what constituency is, as well as some considerations from our viewpoint. As professionals, we have a knowledge and skill base. That's sort of a basic. Then there's the next silo is patient education, patient care, again, from birth to death. And then how we are able to provide our services, not only in terms of standards, but in terms of payment systems and structures. And this is something that is so universal to all of us as NAP members. We can't function, we can't be viable unless we are able to provide services for which we need to be paid for in order to keep our doors open to continue to provide those services.
Hi, my name is Janet Debbie. I am a National Academy of Practice member. I'm a public policy fellow, and I represent the American Speech Language Hearing Association. My colleague Lisa Milliken and I presented this topic at the NAP forum. we are going to be, or I'm going to be talking about audiences and understanding the audience today. So we'll move on to the first slide. So one of the things that we know is that there are various types of audiences that our members will need to interact with. We certainly have members of Congress and their staff, and if you've been to Capitol Hill and done visits, you know that oftentimes you meet with a member of a congressional staff member, not always a member of Congress, but we know that their health legislative aide, for example, is a good conduit to that member of Congress because they understand the issues and they help the member of Congress understand not only the issue, but our interest in providing information and asking for support for various issues from them. We also have members of the state legislature and their staff, and I work in states primarily, so I have an opportunity to work with state staff and state legislators. And what we find there is, again, their staff are smaller. They seem to be more easily approached because they have less, less issues to deal with, and they're certainly focused only on what's going on in their home state. So that's another member of an audience that we might want to interact with. It also might be some member of your local city administration. It could be the city council, it could be county government. Those are also opportunities for us to engage on local and civic issues. And then we also have administrators, whether they're Department of Health, hospitals, other kinds of health-related organizations. We want to have opportunities to do that. And I would encourage you all to think about some of the other audiences that might be in your own area, like your home health agency administrator or the state Medicaid director. There are lots of other possible audience types. Okay, so next slide, we're going to talk about members of Congress, as well as other folks at the federal level. So certainly we can try to engage the office of the president and members of Congress. And again, remember in Congress we have not only the Senate, we have the House, and then more importantly, we have members of committees. So we have committee members that serve on various committees that are important to us. So the Health, Education, and Workforce Committee, for example, is one that would be very important for those of us that are engaged in health and healthcare related issues. We also have regulators, and these are folks that carry out laws passed by Congress. So these are the folks that work in the Department of Health and Human Services, CMS, or the Center for Medicare and Medicaid Services. It might be the Department of Justice, Department of Labor, the Federal Trade Commission. There are all these government agencies that are tasked with regulating or with carrying out rules that have been codified in law by Congress. And the next slide, we're going to talk about some of the state audience members. And again, you'll have similar kinds of hierarchical levels within the state. So instead of the president, you have the governor and the governor's office and the governor's staff. In the state legislature, in most states, we have a bicameral governance. So we have a Senate and a House, and again, Senate and House members serve on various committees of influence that would be important to us. And then we have regulators. So we have those same counterparts at the state level. We might have the Department of Education, for example, or the Department of Health. We also have state Medicaid offices and maybe some insurers that are based in our state or have their home office in our state. These are all state-related folks that we might want to influence or engage in on certain policies. Okay, in the next slide, we talked about a little bit earlier about local audiences, local audience members. And on issues that involve are specific to our locale, we might want to engage the mayor or the county executive, certainly the city council, and then again, counterparts in the county offices. So the county Department of Health, Department of Welfare, those kinds of things are things that we might want to do and engage folks in the local offices. Other players on the next slide are folks that we also need to think about, because these are people we would definitely engage and would want to know about what our issues are and how we want to advocate for change of those issues. So we have folks like administrators in hospitals and their staff, other employers, if you work for a contracting company, who is your employer in that situation. It's really important to engage others on coalitions that you serve on. And most of us serve on a number of different kinds of coalitions. And where do we have influence with that coalition? How do we broach issues that are of common interest to many of the folks that participate in those coalitions? And remember, usually coalitions are formed because of like-minded folks that are coming together around a particular issue. What about constituency groups? What are some of those? What are some of the groups that you might want to engage in around a particular issue that would have interest in that particular topic? Maybe someone who is a managed care director, someone who runs a skilled nursing facility. And then other kinds of players that we don't often think about are things like the media. So how would we engage the media? One of the ways that we know has been effective is to develop a relationship with, say, a health reporter or a media outlet, a newspaper, a website, and become familiar with their needs, help them become familiar with our issues. And that becomes a good way, I think, for us to get issues into the public space, whether through social media, through other kinds of ways to get folks really engaged and understanding of what some of the issues are that we want to advocate for. Sometimes it involves investment in investors, people who are going to invest in a business or invest in something. You want them to understand what the ramifications are of the issue. Now, on the next slide, we have done polls, and some of the polls show that folks have advocated with a number of audiences. So we have a whole number of people that have advocated with Congress. So when we did our poll, we had about 44% folks who were in our audience that had actually been to Capitol Hill, had spent some time in a congressional office. Less so in state legislatures, although there are some, even less with regulators and insurers. What I think is really interesting is workplace administration. So only 22% of us had even had conversations with our own administrators about issues that we were passionate about, issues we needed to advocate on. And oftentimes we talk about that's really where you start. You start with your administrator. You try to help them understand what the key points of your issue are, what you want done. And then from there, you might move up to your regulator, state legislator. But even 22% is not a whole lot of folks who had an opportunity or had taken the opportunity to try to engage in the workplace with their administration. And then you see less for local government. Only 3% have not done anything, which is good. And in this era, we want people to feel engaged and active and passionate enough about ideas that they want to go out and advocate for change or advocate for those things. Now, on the next slide, we're going to talk a bit about why it's really important to do your homework. And by doing your homework, we mean spending time thinking about who your audience is and what you need to know about them before you can get them to either take a position, change their mind, support a position that you want them to take. So in terms of legislative audiences, some of these things are kind of obvious, but they're good things to know before you go in and meet with someone. So, for example, you want to know their political point of view. Are they Republican? Are they Democrat? Do they lean more conservatively? Are they more liberal? Those things are important. You need to understand that to know where they might stand on your issue. You also need to know about their constituency. So who are the folks that support them? What are their concerns? What are their issues? Do they match up or line up with the things that you're particularly concerned about? And if not, how do you get this member of Congress to see your point of view? You also want to know what they're personally interested in. We always try to figure out where we might have some commonality. So, for example, I work with speech language pathologists and audiologists. We look for folks to see if they have interest in or knowledge of communication disorders and how those impact children and adults. We also want to know what their political agenda might be. In other words, what are they focused on? What do they want to accomplish while they serve the citizens of the United States in their position in Congress? What is it that they're passionate about? And again, to see if there are any connections that can be made there. And then very importantly, and one that I think we forget about a lot, but it's really important, is their committee assignment. So what committee do they serve on? As an example, if you have a, let's say you want to, you're concerned about funding for healthcare services for very young children, so early intervention services. Are they getting the healthcare services they need? Are they getting, kids with disabilities getting physical therapy, occupational therapy, speech and language therapy? And if not, why not? Is there a funding issue? Is there an access issue? And if your member, the person you're talking to, serves on, say, the Judiciary Committee or Labor Pensions Committee, they're not very interested in that issue. You need someone who's on a healthcare, or like health education and workforce committee, something that they have knowledge and interest in. So it's important to know what those assignments are, and then what level of commitment you can get from someone who, say, doesn't serve on one of those committees of jurisdiction versus someone who does have a real role on a committee that is of importance to you. Okay, so next slide. We're talking here about other kinds of audiences, not just members of Congress. So again, when you're thinking about other audiences, what are their priorities? What are the things that they need to do, they want to accomplish? What is important to them? And those are based, like any of our priorities, on their own experience, on the folks that they interact with regularly, on what they feel are the needs of the group that they're serving. You also want to know if they have any understanding or perspective on your issue. Maybe they've had a very good experience working with, with someone in healthcare. Maybe they've had a very bad experience. You need to understand and know what that could be. You want to see if they've had any prior experience at all in the system that you're working in and the issue that you're advocating on. One of the good reasons for that is because you want to be able to connect with them and have some shared knowledge. And if you have some shared knowledge, then the assumption is that you'll find some common ground. Even if you don't quite agree on the issue or have the exact same perspective, you will have some commonality. And that helps you understand then how you can get a positive result, what you need to do to try to convince this person to support your position, to oppose something that you think is not in the best interest of your clientele or the folks that you're advocating on behalf of. It also helps you decide how you would respond to someone who opposes you. So in the example we gave earlier about providing more funding for early intervention or early education, early health care. If you have a member, let's say, or a person that you're talking with that really doesn't want to spend any more money on early childhood services, since we don't have the money for that, we can't really afford to do more for little kids or for infants and young children. What is your counter argument? Well, one of those might be that this is a fiscally conservative person you're talking to, so they don't want to spend a lot of money. But they understand the argument that if you front load and spend some of this money early on, that those children will require less services later. They'll require maybe less healthcare services, less education services. Maybe they require less vocational help or housing when they're adults. So if you put the money up front, then you spend less later. And for a fiscally conservative person, that makes sense. So you want to think in terms of how you can respond to people who are going to oppose you with an argument that makes sense to them from their perspective. Okay, let's go to the next slide. Years ago, we did I wouldn't call it a survey, but we did sort of a questionnaire with a bunch of members of Congress and state legislators to find out how they're most influenced. What are the things that really trigger them to listen and pay attention to what you want them to do or have to say? As you might guess, the most powerful influencer is some sort of face-to-face communication. So if you can sit down with this person either at their office, if it's a member of the legislator in their home district, if it's at a coffee shop, if you have an opportunity to meet them face-to-face, that's probably the most powerful influencer. Now, we obviously can't do that with everyone. We don't have the opportunity. We don't have access to those folks, but we can do some other things. So an original letter, typed or handwritten obviously is great, that outlines the issue for them and what you want them to do. That also has a powerful influence on a lot of folks. If they think that you've taken the time to write them personally, to lay out what your concerns are and the solutions or the actions you want them to take, that makes a big difference. Sometimes a phone call directly to the legislator, to their aide, to the administrator, to whomever. Again, if you can lay that out and articulate your position, that's also a very good thing. Email can work as well, as long as it's tailored and it's straightforward and it, again, points out what the issue is that you're concerned about, the solutions that you propose, can also work. One of the things we know, and I think is pretty self-explanatory, is what works best in any kind of situation where you're trying to influence someone and you're trying to advocate for a position is that you use personal and thoughtful communication. The only caveat to that is occasionally you will just want the member of Congress to understand that you have a lot of people are concerned about an issue, and your single letter, while it's influential, maybe isn't the best way to let them know that lots of people are really concerned about this. So in those kinds of situations, sometimes a form letter will really work, because you send a form letter to send a form letter to a member of Congress or to a legislator, and you get 500 other people to send that same form letter, then all of a sudden they're inundated with messages about this, and they can say, wow, we have loads of people, lots of people who are really concerned about this. They're not as concerned about what the message says because it's a form letter, but they're concerned about the fact that this many people reach out to them. We had an example of that in our own, my own shop, where we sent out a letter about an issue to a state legislator who was supporting the issue and we were opposing it. We had about 400 people send out this email blast to the legislator, and they did it within the first, within an hour or two of when this issue became public. And he actually got in touch with us and said, okay, I get it. Don't send any more messages. I understand your position. I've thought about it. I can see where folks are coming from and what they want me to do. So in that case, a generic form letter really worked for that particular issue. And it really was a quantity over quality kind of thing. But it helped the legislator, in that case, understand the real depth of the problem that we were dealing with. So in the next slide now, these are some things that we've learned over time in having face-to-face meetings with, with everybody, but particularly with legislators. These are important things to remember. So first of all, let's talk about some of the do's, some of the important things you should do. First of all, you should always be positive. Even if you know you're meeting with someone who is very opposed to your position, who is maybe even be confrontational, you need to always try to be positive. You need to be upbeat. You need to be passionate about your issue, but you don't need to engage in an argument with someone over this. You need to ask for support. You need to say, this is what I'd like you to do, and wait for them to reply. Sometimes they will not be able to give you a reply, but you always want to wait. That's important. You also want to write a personal note, and that personal note might be just a thank you note. They will read those. Handwritten thank you note goes a long way. You want to inform your colleagues about the results of your meeting. How did it go? How did they respond? Can you expect them to respond positively to support you? And then anytime they ask you a question you can't answer, it's always good to provide some additional information. That is a good thing. It means that it's another opportunity. In terms of don'ts, you don't want to be confrontational. You don't want to get off topic. You want to stay within your message, whatever that is. It's really important to use terminology that people will understand. Don't go into a lot of jargon because that doesn't help. They don't understand that. You need to use common terms that people will understand. And when it's time to go, it's time to go. You need to thank them very much for their time. You need to offer to come back if there's more questions that need to be answered. But you don't want to overstay your welcome. So I think when we talk about understanding the audience, it's most important to do your homework, to understand the position of the person that you'll be talking to know what their issues are, what their constituency says, what their own personal beliefs are. And then you need to know how to present your position in a short, cogent manner, wait for a response, and be able to answer any kind of opposition, have a response to someone who opposes what you're asking them to do. You need to leave with a very positive note. Be sure and send a thank you when you're finished, and send any additional information. Again, remembering that's just another opportunity for you to connect with folks. And you'll find that you have a lot of success. What I learned, and I want to leave you with a little story, is when I was first doing this, one of my first opportunities to meet with a member of Congress was in Ted Kennedy's office. And I was really excited about the opportunity to talk to Senator Kennedy. I knew that I had a position, I had my talking points, I had everything prepared, I was ready to go. And when I went in the office, I was expecting to talk to one of his lower level staff person, and he came in. And there he was. And it was so exciting to meet Senator Kennedy that I lost my train of thought. We ended up talking about things that were important to him and his family. We talked about his sailing. We talked about his dogs. His time was up. I hadn't presented anything that I needed to present to him. I hadn't asked for anything. I hadn't gotten his position. I didn't know where he stood. And I left that meeting realizing that I'd been a very ineffective advocate. Hadn't done any of the things I was supposed to do, any of the things that the group asked me to do. So what I learned from that is that while you want to go and do these things, you want to do them right. You want to be short. You want to be use simple language. You want to be positive. And you want to make sure that you ask for something. You have your ask ready to go. You leave something behind for them to read, and you certainly answer questions. What we've learned from people who do this kind of work on a regular basis, we bring members in, as do many of our associations. What we learn is that once people have done this, a couple of times, whether it's at the local level, state level, or in Congress, they feel very, very empowered. This is something that anyone can do, and once you've done it a few times and you're comfortable and realize these are just people just like you, it can be a very rewarding experience. And I hope all of you that have the opportunity to do this will jump at the chance, because you'll make a real difference in in your own lives, the lives of people that you work with, and it really is a rewarding experience. Thank you very much.